Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, an overview of the Neutropenic Diet. The Neutropenic Diet is a way of eating that may reduce the risk of developing bacterial infections from certain types of foods. Also known as a low-microbial diet, it is often recommended for people with severely weakened immune systems, such as cancer patients undergoing chemotherapy. /r/n/r/n The Neutropenic Diet is named after a medical condition called neutropenia. Neutrophils are an important type of white blood cell, WBC, that help fight infection. When the neutrophil count drops dangerously low, people are considered neutropenic. Neutropenic people can easily get bacterial infections from food and become ill. /r/n/r/n This article will review the key features of the neutropenic diet and discuss its effectiveness. /r/n/r/n Though the neutropenic diet is somewhat controversial, the FDA does endorse safe food handling practices for those experiencing neutropenia. Preventing bacterial transmission is the primary aim of the neutropenic diet. Although most healthy people will recover from foodborne illnesses quickly, those with a weakened immune system may not. /r/n/r/n Your primary line of defense against infection is good hand washing. Properly preparing and storing food also reduces the risk of developing a bacterial infection from food. /r/n/r/n Bacterial contamination often occurs during food preparation. Here are some guidelines to follow when preparing food for yourself or a loved one on a neutropenic diet. /r/n/r/n Some oncologists use the mnemonic PICKY to help people remember safe food practices. The letters in PICKY stand for :/r/n/r/n Once prepared, here are ways to safely store foods consumed on a neutropenic diet. /r/n/r/n Depending on the recommendations from your oncology team, you may be advised to avoid certain foods while undergoing cancer treatment. Foods typically avoided on the neutropenic diet include /r/n/r/n Although the neutropenic diet has been prescribed to cancer patients for years, there is no scientific evidence that shows it reduces infection rates during cancer treatment. In fact, these strict recommendations may be doing more harm than good. /r/n/r/n Patients undergoing chemotherapy often experience a decrease in quality of life due to fatigue, loss of appetite, and stress. Not allowing cancer patients to eat and drink foods that satisfy the body and the mind can contribute to nutritional deficits and depression. /r/n/r/n Conclusions from a 2018 study of children receiving immunesuppressive chemotherapy confirmed that neutropenic diets should be replaced with the FDA's approved food safety guidelines. /r/n/r/n In addition, the neutropenic diet is not standardized, meaning there are no published guidelines on the correct way to follow it. Instead, each cancer center adjusts the diet requirements according to their preference. This can lead to inconsistency and confusion for patients. /r/n/r/n 2019 study in the American Journal of Clinical Oncology, which evaluated 5 randomized trials involving 388 people on chemotherapy, concluded that the use of a neutropenic diet was not associated with decreased risk of infection. /r/n/r/n Maintaining good nutrition during cancer treatment is further complicated by other side effects of chemotherapy. Some of these include /r/n/r/n In addition to safe food practices, here are other ways to reduce your risk of developing an infection during cancer treatment. /r/n/r/n People at risk of neutropenia are often prescribed medications called granulocytecolony stimulating factors, GCSFs, such as Neulasta Neupogen, or Ryzneuta. These medications stimulate the production of neutrophils, resulting in decreased risk of acquiring an infection. /r/n/r/n The neutropenic diet is a nutritional plan for those with a weakened immune system due to cancer treatment. Since contaminated food can cause bacterial infections, the Neutropenic Diet recommends safe food handling in addition to avoiding certain types of foods. /r/n/r/n However, studies have not proved that the Neutropenic Diet reduces the risk of developing infections. Therefore, some oncology clinics emphasize safe food handling practices rather than following strict neutropenic diets. Talk to your oncology nurse about how to stay infection-free during cancer treatment. /r/n/r/n Although there is no evidence that the neutropenic diet reduces infection rates during cancer treatment, your oncology team may continue to recommend it. Talk to your oncologist before starting any new diet while on chemotherapy. /r/n/r/n Although neutropenia alone does not usually cause fatigue, combined with other side effects of chemotherapy, it can result in feeling tired and run down. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.